URC, Ohio. Today we are going to be discussing PrEP, and we have two different approaches on it, the clinical and the community. So Zach, if you could please introduce yourself and let everyone know what you do.
Sure. I'm the Community Engagement Manager for AIDS Resource Center Ohio. I oversee PrEP and PEP implementation, access, advocacy, outreach, education, anything statewide.
Okay. Sharon?
Hi. I'm Sharon Jones. I'm the Certified Nurse Practitioner at AIDS Resource Center. I do HIV management for those that have HIV, and I also do the prevention, which we'll be talking about today, PrEP. Besides myself, there are also 4 other physicians that come to the clinic and provide that care as well.
Okay. I guess let's go ahead and roll right into it, guys. So let's start with Sharon. What exactly is PrEP?
So PrEP stands for pre-exposure prophylaxis, and in general, it's when you have a certain activity or certain treatment to prevent unwanted outcomes. Specifically for HIV, when we talk about PrEP, we talk about Truvada, which is a once-a-day medication that is taken for people that do not have HIV. And so when we talk about PrEP, that's specifically what we'll be talking about today.
Sharon brings up a good point, though. PrEP isn't anything new. It's something that we do every day. So if you're applying sunblock, that's a form of pre-exposure prophylaxis, or taking the birth control pill, or getting a malaria vaccine. So there's lots of different forms of PrEP, but this specifically, the one we're talking about, is just for HIV.
Yes.
Perfect. How effective would you say that it is?
PrEP, if taken as prescribed, is effective anywhere from 92 to 99. We even say 100%.
Wow.
Yep, yeah, we've had some good outcomes.
Nice.
Yeah, I mean, I think like with any medication, if you don't take it, it's going to be less effective. The great thing about PrEP is that it's highly effective, so even if you miss a dose or 2 a week, that's okay. It's really forgiving on adherence. So.
Okay. Now, how exactly does PrEP work?
What PrEP does, it prevents the virus, the HIV virus, from entering the cell, and if it can't enter the cell, it can't copy itself. And with HIV, what it does, it attacks the cells, enters the cells, and then it starts to copy itself, and then it takes over your immune system, and that's how people, if not treated, can get ill. So with Truvada, the once-a-day medication, it prevents that from even occurring.
Okay.
And I get a lot of questions from people out in the community who say, well, if it can't enter the cell, then is it just floating around in your bloodstream? Could you still pass it on to people? And that's not the case, right?
No.
HIV
Right.
can't survive outside of the cell.
It cannot, yeah, great point, yes.
So with all the recent advancements in medications in HIV prevention, would you say that PrEP is the only drug available to do so, or?
PrEP is the only medication available to prevent HIV at this time.
Okay.
But not only do we encourage PrEP, but we also encourage risk reduction behaviors, which we have counselors for that. We also still encourage condom usage, and so, but as far as specifically for HIV prevention, PrEP is Truvada is the only medication indicated for it.
Yeah, it's the only medical prevention. There are still lots of other ways to prevent HIV. Obviously, abstinence, staying in a monogamous relationship, using condoms, knowing your partners, knowing your partner statuses. If you have an HIV positive partner, making sure that they are on medication and in treatment and remaining undetectable. Lots of different ways that you can protect yourself. PrEP is one among many.
Okay. Now, seeing that they are drugs that do prevent and/or stop the multiplication of HIV, in regards to PEP, how is PrEP different?
In regards to what?
To PrEP, how is PEP different?
Oh, yeah. It's 2 different things. So we talked about PrEP, and that actually helps to prevent it, and it's a once-a-day medication. With PEP, instead of pre-exposure, it's post-exposure. So let's say that someone's out and maybe they partied a little too much and they didn't ask those questions. Hey, do you have HIV? Or they don't know if the person that they had sex with, or you know, or maybe they knew the person had sex, but they were drunk, or whatever the case may be, and they may have been exposed, or they had a concern, high risk for being exposed. So PEP is post-exposure prophylaxis, and it's a 1 pill, well, usually a 1 pill per day regimen now, but there are some other medications to help to prevent it after exposure. Okay. And the important thing to know is seeking treatment within 72 hours is the most important thing to know. We encourage people as soon as they've been exposed to make the phone call. At AIDS Resource Center, we provide that care. If we're closed, then they should go to an emergency room, but we definitely provide that care. Okay. And so within 72 hours, definitely, but the sooner you're treated is the best.
Okay. And post-exposure prophylaxis can be for those times. It can also be if someone suffers a sexual assault,
yes,
or if they are an injection drug user and they're concerned about their needle sharing. It's a morning after pill for HIV.
Good point. Yes. Yeah.
Interesting.
Yeah, I like that.
Okay.
And something I wanted to make clear is Truvada is not used for PEP. Okay. So if someone knows someone that's on, PrEP for, prevention, it's not enough to go and use someone's Truvada.
Okay.
Okay. So there are other medications that are used for post-exposure.
Oh, okay. Interesting. Just kind of jumping back to PrEP. So I think it's kind of a question that everyone who does have knowledge about PrEP, they would want to know. Can PrEP ultimately solve HIV? Will it cure it?
No, unfortunately not. Truvada is an HIV medication, but used alone, it can't treat HIV and definitely not cure HIV. Truvada is 2 HIV medications in one. When we look at treating HIV, it's best to have 3 active medications, and you don't get that with Truvada. Okay. So it does not cure, and it is not alone, it doesn't effectively treat HIV.
Okay. That's why it's really important for people who are on PrEP, who are taking PrEP, to go back to their doctor regularly to get HIV tests, because if for some reason they do contract HIV, they need to be moved to a full medication regimen. There are potentially dangerous ramifications if someone becomes HIV positive and remains on Truvada. It's not enough to take care of them or to keep them healthy, so we need to make sure that they're in care and know their status so that we can get them treated.
Okay. How long has PrEP been around?
Oh, go ahead.
Sure. Well, it's been used. It's been used in the treatment of HIV for about 11 years now, and it's been out for prevention for about 3 years. So we've been using it at AIDS Resource Center for prevention for 2 years now.
With our Columbus location, I think maybe a couple years. The Dayton, our anniversary was November, so yeah, a year in November.
Right. So it has been out for over a decade. I think there's a lot of concern about long-term side effects, but we haven't seen any serious long-term side effects in people living with HIV who may or may not have compromised immune systems. So it's important to note that there is some data out there that suggests that PrEP for moderate long-term use is safe.
Okay. So who supports PrEP?
Yeah, basically everyone supports PrEP. The World Health Organization, the Centers for Disease Control and Prevention here in the U.S., the U.S. Federal Drug Administration, and nearly every single AIDS service organization across the country and many around the world support PrEP for prevention of HIV.
Okay. Now, I noticed that we did say that PrEP is, it's kind of a pre-exposure, but is there anyone else, or just overall, who would you say that PrEP is for?
PrEP, we screen people pretty much based on their risk factors, but the bottom line, and you can go into more detail about this, if you're having unprotected sex, you're at risk. And so for those that are having unprotected sex, they're at risk. There are certain categories that are considered higher risk, and so would you like to kind of...
Sure. Populations that we see who are most at risk for HIV, particularly young men of color who have sex with men, so Black and Latino men who have sex with men, gay men of any age, race, or ethnicity, trans women, trans men, people who have been incarcerated, people who inject drugs, people who have partners who have sex with men who have been incarcerated or who inject drugs. As you can see, these slowly start to build up to where it's much easier to just say, if you're having sex without a condom at any point in time, you're at substantial risk for HIV and you should probably consider PrEP.
Okay. And another area that we use it for are for those that maybe, like I've had patients that the woman wanted to have a baby and her husband or boyfriend was HIV positive. So we also give it to women that want to have a baby just to reduce her risk in the first place because she's, partnered with someone who has HIV, but then also to try and give her that protection, which in the long run will protect the unborn child.
Sure, and even though there are no reported cases of transmission from someone who is undetectable and HIV positive, we still advocate for people who are in serodiscordant relationships where one person is positive and one person is negative. If they want that extra layer of protection, PrEP offers that for them, and it really gives them a lot of peace of mind as well. And particularly, Sharon, you said women, we do recommend it for African American women in particular. They suffer substantial rates of HIV infection, and it can be a really empowering tool for people to take a pill rather than to have some sort of complex condom negotiation, right? If you're the receptive partner, then you don't really control who wears the condom necessarily, but you can take a pill discreetly and you can protect yourself that way. So.
Okay.
And we still do encourage the condom use, but there are some, relationships, where it's just, they just won't let them do it, So, at least they can have that option of protection.
Absolutely. Now, when we talk about limiting, I guess, the risk factor, is it feasible to say that, or are there any known cases that either one of you know that a partner did, in fact, transmit HIV because they did not use a condom and, I guess, at the same time that they were using PrEP?
No, I mean, typically the only time when we see HIV infection with people who are taking PrEP is because they were already infected when they started it. So there are two major types of tests out for HIV right now. One is the oral test that you see when you go in to get tested at the health department and things like that. That's the 20-minute or a quick test. And that has about a 2-month window, sometimes up to 3-month window. So someone can become infected and it won't show up on that test for 2 to 3 months. Okay. So people are using that to determine whether or not they're infected with HIV and then begin PrEP. There can be complications there where it looks like they've become infected with HIV while on PrEP, but really it was beforehand.
Okay.
At AIDS Resource Center, we use the 4th generation testing, which shortens that window. Can you talk about that? Yeah, it shortens it to 2 weeks.
Yes.
So it's a finger prick and it's a blood test. It's still quick, so it's done in about 20 minutes, but it lets us know within 2 weeks. It shortens that window down. So if someone has a potential exposure, we would be able to detect it within 2 weeks. And then be able to get them on PrEP if they were negative.
Okay.
Yeah, one thing I want to add is there have been times when people come in and they feel like they want to start PrEP and they've been exposed. If it's been within the 72 hours, we talk to them about PEP, and so we'll do them. We'll have them take PEP for 28 days and then bring them back within that time frame so we can talk to them about continuing on with PrEP. So that's something important to know, that if you do feel like you're exposed to it, we can get you on PEP for those 28 days and then bring you back for PrEP. And so that significantly reduces that chance of the virus attacking the body too.
Okay. Kind of jumping over to costs, insurance, and things like that. Generally, when you think of HIV medications, they're hard to access, and they typically people fear the cost of them. So when talking about PrEP, how does insurance and the cost, things like that, cover PrEP?
Sure. The funny thing about insurance companies is that they also focus on risk. So they recognize that it's cheaper to prevent HIV infection than to treat it, and almost all insurance companies cover PrEP, as well as Medicaid, Medicare. Basically any coverage that you have more than likely will cover PrEP in some aspects. That's not to say that PrEP isn't expensive. It is expensive. That doesn't mean that you should pay the price though. There are lots of assistance programs out there to help people pay for PrEP. Our pharmacy, AIDS Resource Center's pharmacy here in Dayton and the one in Columbus, does a really good job of walking people through those programs. But you can find them at ohioprep.org. That's a statewide resource with tons of information. And there's also, we have literature that we distribute all the time that has all of the information on them as well. So.
And I'd like to also clarify when he mentioned the patient assistance programs. We have patients that come in that don't have insurance, and so a lot of times that's what we'll, through the pharmacists and our efforts, we will get them in contact with a patient assistance program. What we do in the office, because there is some lab that's involved, and we didn't talk about that in monitoring. We did kind of talk about safety, but one of the things with the first visit, we screen for normal kidney function because we have to monitor that. Some kidneys don't like you know, certain medicines, and so it's important for us to follow that. We also like to screen for STIs, so sexually transmitted infections, and that's so when they leave, they at least know that we've checked for everything and we can give them a clean bill of health within a few days. If they do test positive for STIs, then we bring them back and do treatment, and so at least they know where they're starting. You know, they do the risk reduction, and so, you know, they can start off that way. Another thing we like to screen for is hepatitis B, because Truvada does treat hepatitis B also. So it's important to know if you have hepatitis B before you start that medication. Otherwise, if you stop and you've been treating something, it can cause some, you know, adverse reactions, and so it's best to know.
Okay.
I think by and large, that's where the majority of the costs come for folks who are accessing Truvada as PrEP. Because the patient assistance programs do a great job at covering most of the costs for most folks, but they don't cover the labs.
But one thing we do have worked out with CompuNet, with, you know, a local lab, is a certain, so it's like a certain amount that they have to pay. So it's like a reduced cost if they don't have insurance.
Okay.
So.
Yeah, at least at AIDS Resource Center, all of our clinics have a sliding scale. So based on need, we can work out payment options. So if you don't have insurance, or if your insurance won't cover the cost of labs, we're happy to work with you. I don't think that we've ever turned anyone away for inability to pay. We're here to prevent HIV infection, and we'll make sure that that gets done. So,
okay. So just to clarify, then you would agree that even if you do have insurance and you know, you do have a provider, then PrEP can still be affordable, and we still offer ways to
oh,
cover the
absolutely.
cost.
Yep.
Okay. So leading into that, where exactly can I go to get PrEP or PEP?
Sure. Well, I mean, you can go to any healthcare provider. We would love for all healthcare providers to be offering PrEP and PEP. Unfortunately, the CDC recently said only 1 in 3 doctors know about PrEP and PEP, and that even fewer are prescribing it. So you can certainly go to AIDS Resource Center. The medical center here in Dayton prescribes it. There's also an entire list of providers at ohioprep.org. So you can always go there and look in your area. That's a statewide resource, and you can talk to your doctor about it. And if you need help talking to your doctor, you can always call us, and we'll reach out to them as well. So.
Okay.
Yeah, that's one of the efforts that we have prevention educators doing, is trying to get out and educate the physicians and the nurse practitioners to try to implement. And it's just a smooth, you know, way to implement it in their primary care, just to have those conversations, to just see if they're at risk, and to offer PrEP. But it's just a matter of educating more physicians and nurse practitioners, medical providers in general.
Okay. So with that being said, what exactly does taking PrEP mean? Like, I guess, how is a regimen, if I miss a pill, you know, is it still going to be effective? How long do I have to take it for, you know, to build up?
Right, so it's recommended 1 pill daily,
Okay.
and it's best to try and take it around the same time every day. For one, just to remember, and then also just, you know, how it, you know, works in your body. If you forget, it's not the end of the world, like Zach said earlier. When you remember, then you can just take it. You don't have to double up, like some people, you know, believe, oh my gosh, I missed it, let me take 2. That's not necessary. You can just, you know, resume it. So it's most effective, and that's why we say anywhere 92 to 100%. But the studies have shown, the approved studies have shown that it's best if you take it every day. But it can still be effective if you miss here and there. One thing I do want to add, and I think we kind of, you know, briefly talked about it. If for some reason, if your risk factor change, and so if you decide that you don't need PrEP, maybe you get married, and maybe, you know, you were dating a few people and now you're in a monogamous relationship, it is safe and it's okay to stop PrEP. But what I urge people is to make sure, if you decide to get back on it, you get an HIV test. So whoever your provider is, I always ask them, hey, if you decide that you don't want to take it anymore, give me a call, because I'd like to talk about it. So we can, you know, kind of work it out together. Or send me an email. And then once they decide that they want to stop, when they want to get back on it, give me a call, let's bring you in, let's get you tested. If they don't call me, they can talk to another medical provider, or they can go to the you know, local place to get HIV, but don't get back on it until you, you know, get, you know, retested.
The other thing about a PrEP regimen is that some folks will experience side effects, and that's usually just uptake of new medication. This is a really powerful medication, so it can upset your stomach, it can give you diarrhea, some people get headaches. The majority of people don't have any side effects, but even when they do, they usually only last a couple days, at most a week. So, you know, staying in contact with your provider, using like those online resources like MyChart or things like that, to make sure that we're tracking those things is important to us, so that we understand what it's doing and how we can help you.
Yeah, from my experience, it's been well tolerated. I don't have a whole lot of complaints, and I've just had a few people, and it was just like you said, maybe, oh, I had a headache for a couple of days, and I wasn't sure if it was that or something else. But by the time they come back, I mean, they're fine. So, yeah, it's well tolerated.
Okay. Now, I noticed earlier we were talking and we said that you should not, you know, stop using condoms with PrEP. Have there ever been, or that either one of you know of, anything or any type of study that shows that condom usage reduces because you have PrEP now?
Sure, there have been some studies, particularly real-world studies. So a lot of the studies that you hear about with PrEP are ones that were conducted by the FDA or funded by a federal government. There was a study recently in San Francisco that looked at condom use among gay populations, particularly the most at-risk populations. And what we saw is that the majority of people that didn't use condoms before continue not using condoms. The majority of people that did use condoms before continue using condoms. We don't see a lot of behavior change. The fact of the matter is that 1 out of every 3 sex acts is usually condomless. So we know that people don't use condoms now. We know that when they do use condoms, it's inconsistent. PrEP offers the protection all the time rather than just when you use it, you know. So if you forget to take a pill, you're still protected. If you don't use a condom, you're not protected. So.
Okay.
And one of the things that we do stress with the PrEP appointment is to continue to use condoms if they do. But what I love most about PrEP is when people come back and I have to treat them for a STI because they haven't used condom. I mean, they come back and they may have chlamydia, gonorrhea, or whatever it is. I'm like, but they're on PrEP. They don't have HIV. So this is something I can treat. Yes, we encourage condoms. We say it every visit. You know, we have free condoms available at that visit. But they come in for a STI, but they don't have HIV. And so so basically I'm just bragging about Truvada. I mean, it works. But yes, we'd like to, you know, help to reduce, you know, the, you know, risk of getting, you know, sexually transmitted diseases too. So I just had to boast a little bit that, you know, I have people that do come back, but they weren't using condoms anyway. So nothing changed their behavior. Well, PrEP didn't change their behavior. They already had that behavior. So still coming in, being treated for that. But they didn't get HIV. So that shows that it, you know, it works because they could have, you know, had that. So.
The other great thing about being on PrEP is that you are in to see a provider every 3 months, which is way more often than most of us are used to. And getting an STI test every 3 months and being able to get those treated as quickly as possible means that you're less likely to have long-term side effects from it. You're less likely to transmit it to someone else.
Right.
So it's a great public health response in general, not just for HIV, but for STI treatment.
Absolutely. Now, I know that we haven't touched on this yet, and I'm sure, you know, there are questions about this. Are there any age restrictions to PrEP/PEP?
Unfortunately, right now, PrEP is only recommended by the CDC for people 18 and over. We know that people under the age of 18 have taken Truvada as part of their treatment regimen if they were HIV positive. So it is definitely safe for people under the age of 18, but it would be an off-label prescription. Many insurance companies might then not cover it. So we're still working with the pharmaceutical company and with some of the assistance programs to determine whether or not we can get people access who may be at risk who are under the age of 18. There are also studies in place to determine how effective that's going to be. So for now, it's kind of a gray area, but we certainly advocate if anyone is interested under the age of 18 to learn about PrEP, to go to ohioprep.org, to call us. We would love to talk to gay straight alliances and high schools and get the word out as well. Certainly, once those kids are 18 and are sexually active, they're definitely at substantial risk. So.
Now, just kind of switching gears, what are either one of your personal experiences with PrEP, and have either one of you taken it, and if so, why?
Personal, I don't have any personal experience with it.
Sure, I can say just in this year alone, I've had three close friends, disclose to me that they were newly HIV positive, and for me that's really upsetting, particularly because I do this work, right? I work in HIV prevention, and I know that there's a solution that's relatively easy, that's relatively affordable, and so to hear and see my friends still fall victim to this epidemic is really personal for me, and that's challenging to talk to people. And when I'm out in the community talking to people, I feel that sense of urgency, particularly among young people, that HIV is around the corner at any moment in time, and that they could be the next victim. And so for me, there's a great sense of urgency to get that message out there and to make it as available and accessible as possible. I've been on PrEP personally for about 2 years. I haven't had any side effects. I've had a great experience with it. The idea that I could exist in a world where I don't have to worry about HIV for myself is mind-blowing. When I came out to my father at 16, he told me, the first thing was, oh, thank God, I thought it was drugs. And the second thing was, I'm so worried that you're going to get HIV. You know, we watched Philadelphia, the Tom Hanks movie, and he told me all about risk and about condoms, but he also told me eventually I was probably going to get it, and that was a reality. HIV is no longer a reality for me. It's a reality because it's my work every day, but it's not a reality personally, and that's great.
Yeah.
Fantastic. So if someone wanted to spread the word about PrEP or introduce it to their friends, how would they do that?
Sure. Come down to the clinic. Come see you. Daryl works in Dayton and does PrEP outreach. I do PrEP outreach around the state. There are also a ton of volunteers. There are people at the gay bars, at bathhouses, in the leather community. There are websites. You know, we need help on social media. We need help going out to events and talking about PrEP. There's a lot of things that you can do. I think the easiest thing that you can do is to talk to your doctor if you have one and ask them if they're prescribing PrEP or if they're willing to. We have a provider registry that we're building right now for ohioprep.org where we can register doctors that say, I'm going to provide this to people. So people can feel safe and know that they're reaching out to a doctor or a nurse practitioner or any primary care provider that can offer that to them.
Cool. And then where can I learn more about PrEP and PEP? I know that we mentioned the websites, but do you have any other, I guess, type of outlets or?
Sure. ohioprep.org is the local statewide resource, so I think it's a great one for if you're in Ohio. There are other great resources. Whatisprep.org has a video that explains how PrEP works and what it does. There's another one called prepfacts.org, which is based out of San Francisco, and it has a ton of information. It's really beautiful. It's great for young people. It's great for speaking to different communities, right? We know that PrEP isn't just for gay men. It's for straight couples. It's for straight women. It's for straight men. So getting that out there and having that representation, I think, is really great. So those are all some good resources. You can always email any of your questions to prep@arcohio.org, and we'll respond to those as well.
Okay, cool. So we're going to go ahead and wrap things up here. Just to kind of reintroduce myself, I am Daryl Thornton, Community Engagement Coordinator with ARC Ohio. This is Zach Rowe. He is Community Engagement Manager for ARC Ohio. And this is Shiren Jones. Shiren Jones, nurse practitioner down at ARC Ohio. If you do have any questions, need any more information or anything like that, please feel free to stop in. We are at 1222 South Patterson Boulevard, Dayton, Ohio. And remember, if you need any more contact information, just have general questions or to kind of wrap up things or rediscuss anything that we brought up here, you can go to prep@arcohio.org or ohioprep.org. Thank you very much.
Thank you.
Thanks for having us. Appreciate it.